Hi, my name's Sakaya. I'm a student nurse at Palmerton Atlantic University, and we just wanted to go over some health issues, common medications, and any concerns that you have at the school.
Wonderful. Well, my name's Dana. I've been a nurse for 15 years. I got my bachelor's degree about 4 years ago, and I've always done ICU and emergency medical nursing, but this is my first year doing school nursing and I love it. It's been a lot of fun. So one of the things that we see most commonly here is asthma. So I have several drawers full of asthma medications and nebulizer machines. So we have some students that need to use their asthma medicine every day, and then we have others that will only need a breathing treatment or use their inhaler when they have an asthma flare-up. So that's the most common medication I have. We also have some students with severe allergies, so they have EpiPens, and we also keep Benadryl and some allergy medicine on hand just in case somebody were to have an allergic reaction that doesn't have something else to use.
Besides that, do people use a lot of the EpiPens here?
We've never had to use an EpiPen on a student. We have had to have a staff member use their EpiPen.
Oh, okay.
She's highly allergic to bees, and so she actually got stung by a bee and had to use her EpiPen and then had to be transported by EMS to the hospital.
Okay. Are there any issues that you see besides common medications, like health issues with the kids?
During flu season, we did have an outbreak of flu here, and I think one of the things that contributed most to it is it seemed that some of the parents had a lack of understanding of how long they should keep their children home, and that if their fever were to come down because of medication, the parents felt that it was okay to go ahead and send their children in, so they were continuing to expose other students. So we had a couple of classes that over half of the class was out with the flu, so we had to do some pretty heavy education with the parents and the rest of the staff as well as to students that shouldn't be in the classroom, and then having them come in when they came back to school for a temp check and just a general assessment to make sure that they were ready to come back into the classroom, and that seemed to curtail the spread. We also see a lot of ringworm, especially in the lower levels. We have preschool 3 up to 8th grade. So ringworm in preschool 3, 4 in kindergarten seems to be pretty prevalent. So when that happens, we treat it with ointment and cover it, and they're allowed to stay in school. But sometimes that is also hard to stop. Parents don't seem to keep it covered, and that's when it spreads more, I think.
Do you do any education in the classroom with the kids?
We do some. I go into the lower classes more than I do the upper classes, and we talk about hand washing. One of the big things that I do throughout the grades is talk to students about inappropriate and appropriate touch, and making sure that they know it's not okay for anyone to ask them to do certain things or expose themselves, and I try to make sure that they know that they can always come to myself or another staff member if they don't feel safe or comfortable, and that they need to be able to share that information. And so starting from very small, I think it's important that children have a good understanding of what is their own private area and who's allowed access to that. So I'd say that's one of the big things that I do on a regular basis, and then all day long I'm telling kids to wash their hands, don't put your hands in your mouth, cover your cough, sneeze into your elbow, that kind of thing.
Well, thank you so much. We really appreciate it.
You're welcome. Thanks for coming.
Of course.